Outcry on social media, of course, has had a lot of people talking about generally the type of treatment that's given, not only from qualified doctors, but also doctors in training. And so we're asking the question around what avenues are available for people to raise their concerns. For that, let's bring in our guest, the Dean of the Health Sciences Faculty at Wits University, Professor Shabir Madhi, who joins us now via our video link. Certainly no stranger on health matters. Prof, it's great to see you. Thank you so much for agreeing to speak to us on this very important issue. And we're speaking off the back of, let's call it a statement, released by the faculty yesterday, where you essentially appealed to training doctors from your institution to remember their oath. Before we get into that, let me just get your initial reaction to the claims that have been made at Helen Joseph Hospital, especially because in many ways, the story isn't new.
Good morning, and thank you for having me. And certainly what Mr. London exposed is something which is, I would say, endemic across healthcare facilities in the public sector, unfortunately. It's only because of his background that he basically used his skill set to really expose an experience at Helen Joseph. But that being said, I think it's important to mention, firstly, is that the majority of healthcare workers are extremely committed and dedicated to their work. But the experience that he's faced is something which even a dedicated healthcare worker, perhaps it's oversight on the part of even dedicated healthcare workers, in terms of the need to engage in a particular manner with patients, especially when they're in their most vulnerable state. But in addition to that, I think what you also need to unpack is that these healthcare workers are working under very, very demanding conditions in really poorly resourced healthcare facilities which have been allowed to decay over the past 10 to 20 years. So there's a combination of factors which is influencing the patient experience, but that in no way diminishes the need for healthcare workers to respect patients, to be dignified in the manner in which they approach patients, and to do what is really civil, and that is to engage, to communicate who they are, what their role is in terms of the type of healthcare which is being provided to a patient.
Yeah. I suppose then the question becomes, how does Wits help at least training doctors strike that balance? I mean, on the one hand, there's an understanding that a lot of them who are working in those wards are overstretched at a time when they're meant to be learning. So already they're in uncharted territory in many instances. But in the other, there is an expectation of some kind of civility, right? Some kind of dignity, as you've mentioned, to be conveyed to the patients. What becomes the instruction, at least from your institution, to people who are in this really tight corner?
Yeah. So there are three different categories perhaps that we're referring to. The one are the medical students that are basically being allowed onto the platform for the clinical training. And that's the category of individuals that Wits has got oversight on, and we can get them to account for their behavior. Another category of individuals are those who we refer to as interns and medical officers. Now, the interns come from across the country to different hospitals. They're not necessarily from Wits. The interns themselves are employed by Gauteng Department of Health. And similarly, another category are what we refer to as the consultants, the specialists, who are also employed by Gauteng Department of Health. Now, Wits as an institution, unfortunately, in the absence of a memorandum of agreement that's implemented between Gauteng Department of Health and the university, is unable to have any sort of oversight or any sort of influence on the interns, the medical officers, or the specialists, because they employ the Gauteng Department of Health. But again, that in no way sort of excuses Wits from trying to influence the behavior of those individuals, especially when those individuals are practicing in the academic platform that we're using for the training of specialists as well as students. So I think what it really calls for is for there to be a closer collaboration between Gauteng Department of Health and Wits in terms of how we manage the staff that are being employed in these institutions.
Sure. Fair enough. Part of what you've mentioned in your statement out to, some people who have attachments to the institution is that even patients have an ability to report any kind of ill treatment, which may have taken people by surprise. I'm not sure if people know about that. So perhaps you can speak to us a bit more about what that process entails, Prof.
Yes, certainly if there's any misbehavior on the part of student, that sort of complaint should come directly to the university and in fact directly to my office. But when it comes to staff, there's the Office of Health Standards Compliance, in which sits the Health Ombudsman. Now, there's actually a website where any patient can upload any sort of complaint against an individual, against a facility. And the health ombudsman, by law, is compelled to actually investigate every complaint that's submitted to that office. I'm not too sure whether Mr. London, as an example, actually submitted it, and I would encourage him to submit it. And I would encourage every other patient that feels that they're being sold short, they feel that they're being compromised in any way in terms of the dignity or the quality of care that they're receiving, or the nature of the facilities that they're in, to actually lodge complaints to the health ombudsman. Because unless we hear the voice of the patient, these sort of problems will be allowed to continue to fester. And the individuals that are really, really compromised at the end of the day are those that are most vulnerable and those that don't have any other choice but to make use of public healthcare facilities.
Yeah, absolutely. I mean, you'll appreciate that there are many cynics among us. I wonder if you can remember just from the top of your head whether any of those kind of complaints have resulted in any action, quite frankly, whatever that looks like.
Yep. And I think that's an extremely important point. I think there needs to be transparency on the part of the health ombudsman. Every complaint that's lodged to that office should actually have a public resolution in terms of outcome. So transparency is absolutely essential. And there needs to some extent, I would argue, that the health ombudsman should be someone that's independent, that's not actually appointed by the Minister of Health, someone that's independent, that's appointed by civil society, but is resourced by the Ministry of Health to actually look into these sort of complaints and then to be objective in terms of determining whether there's merit to it or not.
Yeah. This issue, or what's taken place in Helen Joseph, as you've mentioned already, Prof, has really brought to the fore a whole range of other matters, including this ongoing debate around what the solution to what's taking place there actually is. It seems everybody agrees that there's a problem. Everybody agrees it's been a long-standing problem. But what I've seen in terms of the feedback is whether or not NHI is the solution to that problem. What's your expert kind of take on that kind of discussion?
I think there's two parts. Firstly, I think we need to be cautious. This is not an issue that just affects Helen Joseph Hospital.
Yeah.
If you go to a number of other hospitals in the province and across the country, unfortunately, you would have a very similar sort of experience, which is really regretful. When it comes to the issue as to whether NHI is the magic bullet to solving all of the problems that we're currently experiencing, unfortunately, I disagree with that. NHI is not going to bring about sort of fundamental changes in terms of governance and management of our facilities. I would argue there's enough money that's being invested in our public healthcare system to actually enable quality healthcare to be delivered in the public healthcare system. The notion that our public healthcare system is underfunded is fundamentally incorrect. South Africa spends more per capita on a public healthcare system than any other country on the African continent. Yet when it comes to health outcomes, we are amongst the lower quintiles of countries with health outcomes such as infant mortality rates, such as perinatal mortality rates. So we've got resources in the public system to actually ensure that we're able to deliver quality health care, but it's simply not taking place largely because of poor management in our facilities and poor leadership.
Fair enough. Professor Shabir Madhi, we appreciate you taking time to speak to us. Always important issues to be discussed, especially when it comes to issues to do with health and people's lives. Professor Madhi speaking to us there in his capacity as the Dean of the Health Sciences Faculty at Wits University.